Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
The Christmas shortages that many newspapers are warning of. 9 minutes before 8 is the time. This is what you're saying on the text, tweets and emails. Brian in Epsom seems furious with me. It's you and the media saying there's going to be shortage. People then panic and overbuy. The media causes the problems. Just let the situation pan out naturally. Look what you did with petrol. I didn't know it was solely down to me, but thank you. Meanwhile, Christine in Lewisham says, I always buy my Christmas presents in September. Everyone always laughs at me. Who's laughing now, seeing as all the presents are bought? Well, congratulations. I haven't even thought about it yet, but I imagine I should write more on that in a moment. Let's come to the other big story today, which is this reform as regards your need to see a GP. And we talked about this, didn't we? We took that heartbreaking call from Ahmed in Bromley on Monday, whose belief was that he was unable to see a GP, and he, in turn, thought that contributed to the early demise of his wife. Well, the government have decided to take action so that you can see your GP, but doctors could be named and shamed if they fail to see their patients. They could face penalties for seeing too few patients. Some new sort of doctor's orders. And here to explain, Health Secretary Sajid Javid. Good morning, Secretary of State. What are you bringing forward today?
Good morning. Look, Nick, first thing I'd say is that I think our GPs have been doing a phenomenal job over the pandemic and have nothing but praise in how they've approached that and all the help they continue to provide. But this is about giving more support to GPs so they can see more patients promptly in a way that the patient chooses. And there's a lot of things in this package, but if I can just highlight two or three things very quickly. The GPs rightly came and said, look, if you want us to see more people, we need more funding for capacity. So this is £250 million in terms of a winter access fund. They wanted to see changes in the infection protection control guidance so they can get more people in their surgeries, but obviously in a safe way. And that's what the UK Health Security Agency is exactly what they've done. And they said, look, can you take some of the workload off us and put it into other parts of primary care? And that will really help us. And that's why we're expanding what's called the community pharmacy scheme. And taken together, this means that more patients can be seen promptly, including far more face-to-face.
There's a lot of stick, though, isn't there, Secretary of State? I read these headlines. GPs named and shamed if they don't see patients. Doctors face penalties for seeing too few patients. Is that the way to bring them back to the table?
Well, I've seen some of those reports, but I'd rather stick to what's actually happening. And we are providing more transparency at the practice level. So at the moment, when someone wants to see how the data on GPs in their region is done just that at the regional level, and we have been piloting actually now for a couple of years, the NHS has been piloting at a practice level. And I think it's important that patients get to see information at the practice level, not least because I believe in levelling up healthcare across the country. I think there's too many disparities in healthcare, and the more data we have, the better that is.
But what is the purpose of league tables, Secretary of State, other than to show that Dr. Ferrari, who's languishing at the bottom of the table 5 years on the run, is clearly a shocking doctor? What does that achieve for Dr. Ferrari?
Well, look, we won't be publishing any league tables.
You won't be?
No, we won't be publishing league tables. I think what you're referring to there is that once the data is available on a practice by practice basis, at a regional level or a national level, people can take that data and study it in the way that they want.
But it's your suggestion that it's made available, surely.
The NHS is making the data available. This was a decision actually made. Yes, of course.
But do you support league? Okay, well, do you support league tables?
Nick, I'm answering your question. The decision on the transparency, what you're referring to, was made a couple of years ago, before I was Health Secretary, and I fully support it. So just to be clear, it's a decision that was made with doctors a couple of years ago. It's going ahead, and that data will be published on a practice-by-practice level. But the more important thing here is that the overall package, the new stuff that's being announced today, which is the cash, the involvement of more pharmacies, the changes in the infection protection guidance, all of this, plus the other measures taken together, will mean that more people can be seen.
And in your article in today's Daily Mail, you write, we also need to measure GPs against clearer standards. So we're getting the idea of efficiency of getting an appointment. What are the other standards to which you refer?
There will be new standards that the NHS will publish as a result of this pilot that they've done, based on collecting more data. But it will include information like not just how you're being seen, but, for example, how long someone, when they phone, how long they might have been waiting on the phone, how quickly are they seen after they phoned into a GP surgery. So there'll be multiple levels of data, as we do with other parts of the NHS, for example, with the 999 service, the 111 service. These are all important health services, and we should have the same level of data with transparency.
111? No, surely.
No. What I mean is that we collect
you're right.
data.
We need to measure GPs against clearer standards. I've got the efficiency of how quickly my listeners, you or I, could see a doctor, but I don't see what the other standards are. What else have doctors got to get right?
Well, we have, so for example, where doctors have patients that have long-term chronic problems. So it might be, for example, they have diabetes, they might have asthma.
Right.
We want to make sure that those people have regular tests. They're called in. They might not call their doctor themselves, but it's important that at least once a year, for example, if you have asthma, that you're asked about that, and that your current state is recorded, so that we can better target services to those kinds of illnesses.
Just out of interest, and I wouldn't dream of asking what it was for, but when you last needed to see your GP, how easily did you get access to him or her?
Fortunately, I haven't had to see my GP for a few years.
Wow.
And when I did, it was I called the practice and I went to see my GP the same day.
Wow. Well, that is a tribute to your lifestyle. Just before we move on to other matters, your appointment as Health Secretary, why did that please your mum so much? Would you tell my listeners?
Because...
you write about this in the Daily Mail today.
She always wanted me to be a GP, as she did with all her sons, and sadly none of us did, to her sadness. But the story I told her a week ago was that when I did call her up after I got this job, and I said, told her about the job, and she said, well, you never quite made it to GP, but at least you're Health Secretary.
Well, good old mum. Can we talk about some other matters? There is a determination, a Whitehall and local government issue, to try and get people back behind their desks. What is the percentage now in the health and care departments of the percentage of people who are actually back in their respective offices?
I don't know the actual percentage, and it's a bit harder for my department because over the pandemic, I think most people understand, we hired a lot of people, and we didn't have desks for those people that we hired. So I think probably the majority are still working outside the office, and that's simply because we don't have enough desks for everyone.
Are we inching towards peace in the negotiations between the United Kingdom and the European Union over the so-called Northern Ireland issue? Secretary of State.
Well, I think it's clear from what we've all heard in the last couple of weeks, there's still further negotiations to be had. We do think that the protocol needs some sensible changes. My colleague Lord Frost has set that out this week. I know that the EU has published something today. I haven't had time to see that, but it's important that they are engaging in this discussion. I think that's a really good sign.
Coming back to getting people into their office, is it fair to say that possibly the COVID restrictions that were necessary have been kept in place for too long? I point you in the direction of London, the Mayor of London deciding that the fireworks display on New Year's Eve cannot go ahead for the second year running due to uncertainties over COVID. But I'm delighted to say England fans went to a football match this month. England rugby fans can go to Twickenham next month. Are some people using COVID as a bit of a blanket to hide behind, Secretary of State?
Yeah, they may be, and obviously I don't know what's in someone's innermost thoughts, but what I can tell you is that in terms of the COVID restrictions, we took that step forward decision. It was a big decision to take back in July. I think it's proven to be the right decision. And that is based on the expert advice, especially when it comes to the social distancing rules and things, the advice of the UK Health Security Agency. When it comes to the firework display you're talking about in London, obviously that's a decision from the mayor. But from my point of view, I can't understand why that can't happen. I mean, I think there's a perfectly safe ways that can take place. So I really don't understand that decision. But as I say, that's not a decision for the government. It's the mayor's firework display. So I hope he can reconsider it.
But just lastly, building back better. You will know on New Year's Day we see images normally from New York, from Paris, from hopefully Sydney. Nothing again from London. That's not building back better, is it? We need that advert for London and UK.
I think the London fireworks display normally in New Year's is fantastic, and it's a great advert for the UK across the world. And I really hope that decision can be considered. As I say, I see no reason why it can't happen safely.
I'm grateful for your time. Thank you. Sajid Javid, Health Secretary, appearing here on LBC after 1 minute after 8 news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, ministers have announced plans for league tables for GP surgeries to compare the availability of face-to-face appointments. Practices in England which fail to